Generic versus brand name blood pressure medication. What's the difference? When it comes to managing blood pressure, many people wonder if they should stick with the brand name or switch to a generic. The truth is, both types contain the same active ingredients and are designed to do the same job. Regulatory agencies requiring generic medications to be bioequivalent, meaning they work in exactly the same way to lower blood pressure and help prevent strokes. The main differences are in their cost, appearance, and sometimes inactive ingredients like fillers or dyes, but these usually don't affect how well the medication works or its safety. Research shows that generic and brand name blood pressure medicines are equally effective at controlling blood pressure levels. Large studies involving thousands of patients have found no significant difference in how well they prevent strokes or other cardiovascular events. While some small subgroup analyses suggest minor differences in blood pressure control for certain populations, these differences are not consistent enough to recommend one over the other. Overall, generics are just as reliable as brand name drugs for stroke prevention. Cost is a big factor. Generic blood pressure medicines are often 80 to 85% cheaper than their brand name counterparts. This lower price can make it easier for patients to stay on their medication long-term, which is crucial for controlling hypertension and reducing stroke risk. Because of this affordability, generics are considered a cost-effective choice for most people managing high blood pressure. Both generic and brand name drugs must meet strict standards for quality, strength, and purity before they are approved. This means generics contain the same amount of active ingredients as the brand name versions, ensuring similar therapeutic effects. However, inactive ingredients like fillers or dyes can differ, which might cause minor tolerability issues in some individuals, but these rarely impact the medication's effectiveness. Despite the scientific evidence, some patients and even healthcare providers remain cautious about switching to generics. Concerns sometimes stem from anecdotal reports or worries about side effects. A study from Canada suggested there might be increased side effects with some generic blood pressure medications, but this finding isn't widely supported by other research and could involve other factors. It's important to remember that individual responses can vary, and most people tolerate generics just as well as brand name drugs. In terms of stroke prevention, controlling high blood pressure is essential. Since generics are proven to lower blood pressure just as effectively as brand name medications, they are a good choice for most patients. Their lower cost can help improve adherence, which is key to maintaining blood pressure control over time. If someone notices side effects or their blood pressure isn't well controlled after switching to a generic, they should talk to their healthcare provider. Personalized advice is always best to ensure optimal treatment. To sum up, both generic and brand name blood pressure medications contain the same active ingredients and are equally effective in reducing stroke risk. Generics are significantly less expensive, making them accessible and helping patients stay consistent with their treatment. Regulatory agencies ensure generics meet high standards for safety and quality. While some may perceive differences, scientific evidence supports the safety and effectiveness of generics as a reliable option. Always consult a healthcare professional to find the best treatment plan tailored to individual needs, especially when managing a condition as important as hypertension for stroke prevention.